Hello everyone, I'm Dr. Jolsna and welcome to my channel Prostho. So today I have come with one of the most important topics of complete denture prosthodontics, that is balanced occlusion. This topic was suggested to us by one of our subscribers, Sumairuddin. Thank you Sumair for your support and suggesting this topic. So you should never miss this balanced occlusion topic for your exam because it can come as a short note, it can come as a 25 marker essay or even as a long essay, that is a 75 or 100 marks. So before any further delay, let's get into the topic, and before that I request everyone to please do like and share my videos if you are finding them useful, and if you are new to this channel Prostho Hub, please do subscribe, and if you have any queries, feedback, suggestions, any topic that needs to be discussed, please do comment below the video or you can mail me at this mail ID. So let's start. First of all, let's see the contents of balanced occlusion topic. So beginning with introduction, the GPT definition of balanced occlusion, characteristic requirements, significance of balanced occlusion, general consideration that was given by Wingler, the advantages and disadvantages, the various concepts proposed to obtain balanced occlusion. There are around 10 different concepts. Then the various types of balanced occlusion, the factors influencing balanced occlusion, this you can expect as a short note, and how to achieve balanced occlusion. Finally, conclusion and references. So, occlusion is a factor that is common to all branches of dentistry, and it's a term generally accepted to describe the contact relationship of the upper and the lower teeth. Now, what is an occlusal scheme? It is defined as the form and the arrangement of the occlusal contacts in natural and artificial dentition. And there are various concepts, techniques and philosophies that have been documented concerning about the complete denture occlusal scheme. There are various occlusal schemes like the neurocentric, linealized occlusion, monoplane, linear, buccalized occlusion, and balanced occlusion is one among them. So, more comprehensive the understanding of the factors of occlusion, more versatile the prosthodontist will be in treating the various problems of complete denture occlusion. Now coming to the definition of balanced occlusion, so it was reported by Brewer, and GPT-8 defines balanced occlusion as the simultaneous contacting of the maxillary and mandibular teeth on the right and left side and in posterior and anterior occlusal areas in centric and eccentric positions, developed to lessen or limit the tipping or rotating of the denture base in relation to the supporting structures. So basically, in order to avoid the tipping or rotation of the denture base, there should be simultaneous contact of the upper and the lower teeth on right side, left side, anterior as well as posterior in centric and eccentric positions. So GPT-9 has simplified this definition as the bilateral simultaneous occlusal contact of the anterior and posterior teeth in excursive movement. Now, balancing in complete denture is unique and man-made, and it does not occur in natural teeth. So, balanced occlusion is absent in natural teeth and it is not needed also. And a long-term objective of this balanced occlusion is preservation of residual structures in a state of optimum health, that is by better distribution of the occlusal forces. Coming to the characteristic requirements of balanced occlusion, the first one, all the teeth of working side should glide evenly against the opposing teeth. Now what is working side? It is the side to which the mandible is moving during a lateral excursion. So if the mandible is moving to the right side, that means the right side is the working side. So there all teeth should glide evenly against the opposing teeth, and there should be no single tooth that produce any interference or disocclusion of the other teeth. That means there should not be any interferences. And what about the balancing side? There should be contacts on the balancing side also, and they should not interfere with the smooth gliding movements of the working side. So on the working side there is smooth gliding movement, and along with that on the balancing side there should be contact. So there should be simultaneous contact during protrusion also, and intermediate occlusal balance for all position between centric occlusion and all other functional or parafunctional excursion. So there should be simultaneous contact, and this will help in better distribution of forces, thereby preserving the residual structures. So these are the characteristic requirements of balanced occlusion. Now let us see the significance or importance of balanced occlusion. The first one, improved stability of the denture. So from the definition we know that there should be simultaneous contact on the anterior, posterior, right side and left side in order to prevent the tipping or rotating of the denture base in centric as well as eccentric position. So here we know that balanced occlusion improves stability of denture, and absence of occlusal balance will result in leverage of denture during the mandibular movement. The next one, it is more critical during parafunctional movements. So Shepard stated that enter bolus exit balance. So that means according to him, as soon as the food bolus enters the oral cavity, the balance is lost, and so balanced occlusion is not needed for masticatory purpose. But according to Brewer, on an average, a normal individual makes masticatory tooth contact only for 10 minutes in one full day, whereas there is a total tooth contact of 4 hours during other function. So only for 10 minutes there is masticatory tooth contact and balancing is not needed, but for the 4 hours of tooth contact, balanced occlusion is important to maintain the stability of the denture, and hence balanced occlusion is critical during the parafunctional movement. The next significant is, we already discussed, preservation of ridges by better distribution of forces. Next is the general considerations for balanced occlusion given by Sheldon Wingler. So the following points should be considered while developing a balanced occlusion. So in cases of wide and large ridge, and also when the teeth are arranged close to the ridge, you can achieve ideal balanced occlusion. That means there will be greater lever balance. That is, the stability of the denture against the lever forces will be greater. That is greater lever balance. So when there is a wide and large ridge and the teeth are arranged close to the ridge. Whereas if the teeth are arranged far away from the ridge and if they rest on a narrow and short ridge, then they will have a poor balanced occlusion. That means just the opposite. Next, wide ridge and narrow buccolingual teeth also, there is greater lever balance. And when the teeth are arranged slightly on the lingual side of the crest of the ridge, that can also lead to greater balance. That is, ideal balance can be achieved in that case. Whereas arranging the teeth buccally will lead to poor balanced occlusion. So the complete denture should be designed in such a way that the forces of occlusion should be centered anterior-posteriorly in the denture. So if there is more centered force of occlusion, there is greater stability of the denture bases against the lever forces. That means there is greater lever balance. So these were the general considerations for balanced occlusion given by Sheldon Wingler. Coming to the advantages and disadvantages of balanced occlusion. So first, the advantages. Bilateral balanced occlusion is important during activities such as swallowing saliva, and it helps to seat the denture in a stable position. So due to the cross arch balance, that means as the bolus is chewed on one side, the other side, that means the balancing cusp, will either come closer or will contact on one another. So there is cross arch balance and it will help to seat the denture in a stable position. Thus, it improves the stable and retentive qualities of the denture, and we know that it helps to preserve the residual structures by better distribution of forces. The disadvantages, it tends to encourage lateral and protrusive grinding, and it is difficult to achieve a balanced occlusion in mouth where an increased vertical incisor overlap is indicated. Okay, and a semi or a fully adjustable articulator is required to achieve balanced occlusion. So these are the advantages and disadvantages of balanced occlusion. Coming to another important section of balanced occlusion, that is the concepts proposed to obtain balanced occlusion. So there are around 10 concepts, and they are the Guy's concept, which is the first concept towards obtaining balanced occlusion. Then the French, the Sears, Bouchers and Frush concept. The Henne's laws of balanced articulation, which was later modified into 5 factors, that is the Henne's quint, which is a very important short note. Then comes the Trapezono's concept of the triad of occlusion, the Bouchers concept, Lott concept, and finally Bernard Levin's quad concept. So let us see the mnemonic to remember these 10 concepts. that is before going to bed, feel free to have lots of sleeping pills. Hope this mnemonic helps you in exam. The first one is the Guy's concept. So Guy's was the one who introduced or proposed the first concept towards balanced occlusion in the year 1914. So he suggested that arranging 33-degree anatomic teeth under various movements of the articulator enhances the stability of the denture, and teeth has to function harmoniously with condylar and incisal guidance. So the 33-degree cuspal form was introduced by Guy's, and he gave this 33-degree inclination in order to harmonize them with the condylar inclination of 33 degree. So teeth has to function harmoniously with the condylar and incisal guidance. So this will enhance the stability of the denture. So you can see in centric occlusion, the masticatory forces were directed towards the ridge, and in right lateral position, the occlusal contact forces are directed away from the ridge. That means the contact is coming on the cuspal inclines, and the force are directed outside the ridges. So this is Guy's concept. Next one is the French concept in 1954. So according to him, lowering the lower occlusal plane increases the stability of the denture along with balanced occlusion, and narrow occlusal table of the lower teeth and lingual contact help to increase the stability. So the occlusal table was made narrow, and also there was only lingual contact. So he arranged the upper first premolar with a 5-degree lingual inclination, upper second premolar with a 10-degree lingual inclination, upper molars with 15-degree lingual inclination. So there was a lingual inclination given to the maxillary posteriors so that a balanced occlusion could be developed by the arrangement of teeth on a curved occlusal plane. So the occlusal plane was made curved in order to give a balanced occlusion. So in centric occlusion, you can see that the masticatory forces were directed slightly in a buccal direction to the mandibular residual ridge, whereas in a right lateral position, the occlusal contact forces were directed towards the ridge on the working side and away from the ridge on the balancing side. So this was the French concept, and he used modified French teeth to obtain balanced occlusion. So French concept is narrowing the occlusal table of the lower teeth and lingual contact enhances the stability along with balanced occlusion. The third one is the Sears concept. So Sears proposed balanced occlusion for the non-anatomical teeth. So it is very difficult to attain a balanced occlusion for non-anatomic teeth, but Sears suggested using a palatal ramp or a occlusal plane that curves anterior posteriorly and mediolaterally in order to achieve balanced occlusion. So on protrusion, this balancing ramp helps to obtain 3-point contact. So one contact will be anteriorly at the incisor area and 2 posterior contact at the posterior ramps during protrusion, and this will attain a 3-point contact and balancing for the non-anatomical teeth. Next one is the Pleasure concept. So this was proposed by Dr. Max Pleasure, and he suggested using a Pleasure curve or a posterior reverse lateral curve to align and arrange the posterior teeth to get stability for the denture. Now what is this Pleasure curve? The GPT defines it as a curve that is transverse in cross section, and it conforms to a line which is convex upward except for the last molar. So here you can see the Pleasure curve. In the first premolar area, there is a buccal tilt that is for lever balance, and a flat occlusal scheme is for the first molar. So in the premolar, there is a buccal tilt. The flat scheme of occlusion is set in the first molar area, and a lingual tilt is set in the second molar area, and this will provide balancing contact in lateral position. So according to Max Pleasure, this curve runs from the palatal cusp of the first premolar to the disto-buccal cusp of the second molar. So this is running from the palatal cusp of the first premolar to the disto-buccal cusp of the second molar, and here the second molar will give you the occlusal balance and the second premolar gives the lever balance. So this was the Pleasure curve that was proposed by Max Pleasure, and he suggested using this curve increases the stability of the denture by balancing the occlusion. So this is about pleasure curve. Coming to the Frush concept. So Frush suggested the linear occlusal concept, where we do an arbitrary articulator balance which is followed by intraoral correction, that is during the try-in stage, to obtain balanced occlusion. So here there is a single mesiodistal ridge on the lower posterior teeth that contacts the flat occlusal surface of the upper posterior teeth that is set at an angle to the horizontal. So the making of this mesiodistal ridge on lower posterior teeth to contact the flat occlusal surface of the uppers was to eliminate the deflective occlusal contact, and this will increase stability. So in centric occlusion, the contact forces were directed towards the ridge as per this linear occlusal concept, and in right lateral position, the contact on the working side is towards the ridge, whereas on the non-working side it is slightly towards the buccal side of the lower ridge. So this is about the Frush concept, also called as the linear occlusal concept. Next is another important concept, that is the Hanau's laws of balanced articulation, given by Rudolf L. Hanau in year 1925. So he believed articulation of the artificial teeth was related to 9 different factors, and they were the horizontal condylar inclination, the sagittal condylar pathway, compensating curves, protrusive and sagittal incisal guidance, buccolingual inclination of the tooth axis, the plane of orientation, tooth alignment, and relative cusp height. So these were known as the Hanau's laws of balanced articulation. So later on, Hanau condensed these 9 factors and formulated the Hanau's quint, which consists of only 5 factors, and they were the condylar guidance, incisal guidance, compensating curves, relative cusp height, and plane of orientation. So this is a very important topic, and you can expect it as a short note. If you want to know this in detail, do let me know in the comment box. Next is the Tropozano's concept of occlusion. So Tropozano reviewed the Hanau's 5 factors, or the Hanau's quint, and suggested that only 3 factors were actually concerned in obtaining balanced occlusion, and these were the incisal guidance, the cusp angle, and the condylar guidance, and these 3 factors were called as the Tropozano's triad of occlusion. So he eliminated the plane of orientation, or the plane of occlusion, since its location is highly variable within the interarch distance, and also he suggested that occlusal plane can be located at various heights in order to favor a weak ridge. So plane of occlusion is not important for a balanced occlusion. And he also stated that there is no need for a compensating curve, because he suggested that when we arrange the cusped teeth in principle, these curves will be produced automatically. That is, the cuspal angulation will itself produce a balanced occlusion, and there is no need for a compensating curve. So this is the Tropozano's concept of occlusion. So this triad of occlusion was simpler than Hanau's quint, but it eliminated the important compensating curves and plane of orientation. Next is the Bouchers concept. So Boucher proposed 3 fixed factors to attain balanced occlusion, that is the orientation of occlusal plane, the incisal guidance, and the condylar guidance. And he also emphasized the need for a compensating curve. So compensating curve enables one to increase the effective height of the cusp without changing the form of the teeth. That means if the teeth do not have any cusp, the equivalence of a cusp can be produced by a compensating curve, and so compensating curve is important. And he also stated that the plane of occlusion cannot be changed to favor a weaker ridge. That means the plane of occlusion should be oriented exactly as it was when the natural teeth were present. So this is the Boucher's concept of balanced occlusion. Coming to Lott's concept. So Lott related Hanau's factors to posterior separation, and he introduced the occlusion chart. So he stated that greater the angle of condylar path, greater is the posterior separation or unbalanced occlusion, and greater the angle of overbite, the greater is the separation of anterior and posterior region irrespective of the angle of the condylar path. And when there is a greater separation of posterior teeth, there should be greater or higher compensating curves. And also when the posterior separation goes beyond the balancing ability, you can balance it by tilting the plane of orientation. And when there is greater separation of posterior teeth, the greater should be the height of the cusp of the posterior teeth. So these were the factors that were related to posterior separation, that is the condyle path, incisal guidance, compensating curves, plane of orientation and cusp height. And this is the occlusion chart proposed by Lott. Coming to the final concept, that is the Bernard-Levin's quad concept. So his concept is almost similar to that of the Lott's concept, but he eliminated the plane of orientation as it conforms to patient's anatomy, aesthetics and function. So he considered it as not very useful practically, and also stated that the plane of occlusion can be slightly altered by 1 to 2 mm in order to improve the stability of a denture. So he named the other 4 factors of occlusion, that is the condylar guidance, incisal guidance, compensating curve and cusp height, to be the quad. So that is the quad concept. So these 4 factors were considered to be the guiding factors. As each of these guiding factors is increased, the amount of separation is also proportionally increased. Whereas the other 4 factors, that is a balancing condylar guidance, balancing incisal guidance, compensating curve and balancing cusp inclines, were considered to be the controlling factors. So as each of these controlling factors is increased, tooth contact is proportionally increased. So according to him, the condylar guidance is fixed and is recorded from the patient, and the balancing condylar guidance includes the Bennett movement on the working condyle. The incisal guidance is usually obtained from the patient's aesthetics and phonetic requirements, and it can be modified for special requirements, like reduction of incisal guidance is used when the residual ridges are flat. Again, the compensating curve, which is the most important factor to obtain balance. So monoplane or low cusp teeth must employ the use of a compensating curve, and the cusp teeth have the inclines that is necessary for obtaining balanced occlusion, but nearly always are used with a compensating curve. So these were the essentials for a balanced occlusion by Bernard-Levin. So this quad concept is relatively easy to understand and use, and the concept of controlling the posterior separation is considered to be an important goal for achieving a bilaterally balanced denture occlusion. Next, coming to the different types of balanced occlusion, and they are the unilateral balanced occlusion, bilateral balanced occlusion, protrusive and lateral balanced occlusion. So this I'll be discussing in detail in our next session. So thank you all for watching my video. Please do like and share my videos if you are finding them useful. And if you are new to this channel Proso Hub, please do subscribe and show your support. If you have any queries or any topic suggestions, do let me know through the comment section, or you can mail me at this mail ID. So thank you all once again, and we'll meet in our second session.